Coming up today, a father, competitor, and cancer survivor. Hear what it took to endure treatment targeting the back of his throat. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. If you can run a marathon, you can endure pain. If you can swim 2 miles, bike 100 miles, then run a marathon, you clearly have a different definition of endurance. Jon Bohnsack, he endured and even enjoyed Ironman triathlons, but what started as a lump on his neck would test a different kind of endurance. Jon Bohnsack usually starts his day like this. But back in 2022, he noticed something different during his morning routine.
Just shaving one day and noticed a lump on my side of my neck right here on the right side and knew I needed to get checked out.
Jon saw his primary care physician who told him he needed to see an ear, nose, and throat specialist.
When I walked into the ENT, he knew right away what it was.
A biopsy confirmed it was cancer.
He sees it all the time, and guys my age, he got his fingers down my throat feeling around, and he said he knew exactly what it was.
Oropharynx squamous cell carcinoma. Not what Jon wanted to hear.
It's tough more mentally than physically.
But the specific type of cancer Jon had meant he was eligible to enter a clinical trial at the University of Kansas Cancer Center through the care of his doctor, radiation oncologist Dr. Gregory Gahn. Jon opted out of surgery and started radiation and chemo right away.
I do attribute a lot of my success to my physical health and being active and staying active through the treatment. It's not fun. It's never fun. It's hard.
Jon, a husband and busy father of 2, is approaching 3 years with no evidence of disease. He's a man who puts his family and his health first and has said cancer has completely changed his outlook on life.
You want to be around as long as you can, so I want to be here for my kids. I don't want to miss any of my daughter's swimming or my son's soccer. I want to make sure I'm here. Well, he is here, and we are so happy to have Jon with us in studio. And Dr. Gahn is going to be joining us here in just a minute. He's a radiation oncologist here with the University of Kansas Cancer Center. He's going to be joining us here in a second. He's very busy, as you even mentioned yourself. Dr. Gahn is always running around and treating patients, so he's going to be here in studio in just a minute. And you are the first guest of a 2-part series that we're going to be focusing on head and neck cancer, because it's Head and Neck Cancer Awareness Month. Tomorrow, we're going to meet someone who got surgery, and only surgery, but in Jon's case, you were able to get treatment even with surgery off the table. Jon, you're still fit, as we can see. How many miles have you run today? Were you up early?
Not today. I will later today, though.
Of course you will.
Yeah.
How many miles will you get in?
6 to 8 miles today.
Of course you will. So as a triathlete, you're obviously very in tune with your body. Besides that bump, did you notice any other symptoms that were happening?
I didn't, no. The only thing I noticed was a lump on my throat or on my neck right here on the right side, and knew I need to get checked out.
And that's kind of like, I would imagine that's the trouble, is when you're really, really healthy like that, you don't notice a lot going on with your body. You're so healthy. How much time had passed between when you first noticed that lump before you then ended up getting checked out with your doctor?
Yeah, I noticed it, and about a week or 2 later, I knew that it wasn't going away, and I needed to get checked out by my primary care doctor.
So you're shaving that morning. What did it feel like? And did it just kind of feel like it came out of nowhere?
It did. I didn't notice it at all, and then it was just there. And obviously, you get the worst things going through your head, and you don't want to think the worst, but that's what goes straight into your head.
Okay, so we're going to ask Dr. Gahn some of those. I asked you, I said, do you remember what it was called, what stage it was and what it was called? And I said, we'll ask Dr. Gahn to explain and to tell us that big, long word that we don't know how to pronounce.
Squamous cell carcinoma.
There you go. But we did ask Physician-in-Chief of the Cancer Center here at the health system, Dr. Jeff Holzberline, to weigh in on the value of the HPV vaccination.
The HPV vaccine really is one of the few strategies that we have from a vaccination standpoint to reduce certain types of cancer. We certainly know that some of the cancers, such as head and neck, such as cervical, such as penile, can be driven specifically by that virus. And so if we can prevent that virus we could reduce cancers. And we certainly know that although there are risk factors, other risk factors, that HPV and HPV positive cancers occur in non-smokers, people have no other risk factors. So really it's a fantastic strategy for decreasing the risk of developing those cancers, which, quite honestly, those cancers don't always have the best outcome, and so really important to do so.
And Dr. Gann will explain, not in all cases, but in some cases, this cancer could be related to HPV, and we'll talk about that when he arrives. But John, before you met with Dr. Gann, you met with a surgeon. What happened once he opened you up?
Well, I went under anesthesia, and I had told the doctor, I said, you make the choice you would make for yourself. So we had talked about the fact that if they did surgery, it could affect my ability to speak going forward, and I would need help speaking again. And so I asked him to do what he would do for himself. And when he looked at it, he thought it would affect my ability to speak too much, and that's what I do for a living. So I didn't. He made the choice, and I appreciate that, to not do the surgery.
Well, and that's what's interesting, and that's when options really matter, because you were able to talk with your physician about the idea of, hey, I'm a chatty guy. This is how I make my living is
right.
talking. So that must have made you happy to know that there was an option out there that wouldn't have to possibly damage your vocal cords, and then you'd have to go in and do some type of rehab. But there was no guarantee, right?
Exactly, that's right.
So how many sessions of chemo and radiation did you do? Do you remember? It was quite a few.
It was 24, I believe, 24 sessions of radiation every morning, Monday through Friday, and 2 sessions of chemo, which was the first day of my radiation and halfway through my radiation treatment.
And then I want to talk about the mental effect of going on this, because when you get this diagnosis, I just want to know, when you hear the word cancer, you're a young dad. How old were your children at the time?
My daughter was in 6th grade, and my son, I believe, was in 2nd or 3rd grade.
And you mentioned,
so
of course, you
pretty young.
You didn't bring that up at the time. They know about it now, but at the time you did not mention it to them.
Yes, I made the choice. My wife, thank you to her, she stuck by me, and we told them, we decided not to tell them about the diagnosis.
So what, you said the physical part was one thing, but you said this was just more of a mental issue for you. How did you handle this mentally?
Sure, my wife was very helpful with that as well. It's just difficult, the worst things go through your head. You always play the worst case scenarios through your head. I had young kids. I didn't want to miss anything. I wanted to see them grow up. I wanted to see them have kids. I want to see what's in their future as well. So that's the first thing that goes through your head, is you just don't want to miss out.
So how did you tackle that? Did you you're working at the same time, right? You stayed working.
I did stay working, yeah. So when I told my boss about it, it was a very small circle of people I told about my diagnosis. And my boss was one of those people, because I wanted to discuss with him what it was going to look like for the next several weeks during my therapy, during my treatment. So when I told him about it, it just so happened that his uncle had the same diagnosis recently as well, so he understood what the treatment was like. And we decided I would keep working, and I would work through the treatment, and he would be by my side and help me out however he could.
So you talked about it, and it was so great that you invited me out to sit and visit with you, which I really, really appreciated. But you said it wasn't something that you really enjoy talking about. You said when people talk with you about it or ask you about it, you're happy to do so, but it's not really something you love talking about. But you're talking about it today, which we really appreciate you sharing. So how do you kind of find that balance with wanting to share your story and educate, but also saying it's not always easy to talk about my illness?
It's not something I like to talk about. I don't bring it up often. I don't like people feeling sorry for me. I don't want it to be my life story. I don't want people just to look at me as a cancer patient or cancer survivor. I want them to look at me as as a dad, as an athlete, as a supporter of everybody else. So it's not something I like talking about, but I will talk about it, and I'm happy to talk about it.
And we're glad you are.
Yeah.
We really are. We appreciate it. Dr. Gann, nice to see you today.
Hello again. It's good to see you.
Hey, we're glad you're here.
Yeah.
Good to have you. Talking about your patient, John, here, and we're just saying how much we appreciate him sharing his story.
I know, I am too. Thank you again for doing this and agreeing to speak during Head and Neck Cancer Month and everything.
So what do you remember about John's case when you first met him? Just his diagnosis and the stage when he first came to your office.
Yeah, no, I'm like yours when you would come to see us and everything. I think, we had actually thought about it as, hey, this is someone who has been very healthy, has unfortunately had this bump in their road, and so where are you at? And, what can we do for you? Your type of cancer, highly, highly curable. And the question is, what is the best way to kind of go about trying to cure you of your early stage cancer? Was it going to be with potential surgery, with or without any additional adjuvant treatment, or was it going to be with definitive chemoradiotherapy approach? And I think both modalities, are options. But I think in your case, when we were looking at you and discussing you amongst our multidisciplinary group, obviously it kind of pushed in a specific direction, but I think at the same time too, there were opportunities to be had in terms of clinical studies that we could offer you, if that was something that you would have been interested in. So
some patients need chemo and radiation, others need surgery, some need both. In what cases is there a choice between treatment paths?
Yeah. I think in your specific situation, your type of cancer, was actually involving certain parts. Okay, part of it is just some of your soft palate, a little bit of, not so much in your tongue per se, but it was actually creeping. And I think because of that, it would have potentially made the surgery much more extensive in this situation. And I think in this sense, going with what we call an organ-sparing approach, doing radiation with chemotherapy in this sense, would have actually provided you not only similar good survival, cure outcomes, but also at the same time preserve some of the, the portion of the back of your throat and everything. Again, surgery can be an excellent option, especially for younger patients. And I think that's something that the discussion of surgery or radiation has to happen, I think, for every type of oropharynx cancer patient. But in your specific case, I think, again, the extent of your cancer was one where surgery might have led to more challenges in the back of your throat in that situation, and so radiation could be used.
Let's talk about the clinical trial that Jon was able to take part in. Talk to us about that a bit.
Yeah. So no, thanks for asking. So this was Energy HN005. So this was a large-scale national trial, one that your taxpayer dollars, our taxpayer dollars pay to kind of conduct these important studies. As I said, the goal is to cure you, all right, plain and simple. But the problem with our treatments is that they can have long-term side effects, because if our goal is to give you a 30, 40-year horizon, you're going to have side effects from our treatments, particularly late side effects. And those late side effects can impact your quality of life. And so this specific trial was asking, can we de-escalate? Can we reduce the dose of radiation treatment needed? Because the current dose that we use as standard of care does a great job of curing our patients. The question is, can we reduce the radiation dose and still get the same great local cancer control outcomes, and hopefully reduce the long-term late side effects of radiation? And you yourself were actually put on one of the specific arms that helped us to ask that question, to reduce the dose of radiation treatment while still getting kind of that standard of care chemo. And what ended up happening was, you went through the entirety of the trial. The trial itself has since closed and we're trying to collect long-term outcome data. But at this point in everything that, we know that at least from the outcomes of that clinical trial, kind of what our preliminary results are and kind of what we take from it. But I think in the grand scheme of things, this is for you. I can imagine it's either all or nothing. Either I'm cured or something else happened, and cancer recurrence. At this point, I'm still super thrilled. I'm excited, with the time that's kind of elapsed. Still looking good. No signs of cancer, and this is exactly what we were hoping for. And hopefully, you're continuing to do your running, your ultra marathoning, which I keep hearing about. I'm like, man, I'm so impressed as well as envious.
I know, same here. It's like, hey, one of the three of us has to do it, and it's better Jon than us, right? Well, if you have any questions about Jon's story or head and neck cancer or the HPV vaccine, we would love to have a chance to answer those right here on our program this morning. Send us a comment or a question on YouTube or Facebook. You can send those to the Medical News Network. That information is right there on your screen. Dr. Gant, before you arrived, we heard from Dr. Jeff Holzberlein just talking about the importance of the HPV vaccine, because we know that that could be related to head and neck cancers. So what are some typical risk factors for head and neck cancers, and how has the rise of HPV changed the patient profile? Just talk a little bit about that, because we need to discuss that.
Yeah, no, I'm like, so many head and neck cancers, is classically considered one that's driven by smoking, by alcohol abuse, as well as other environmental factors, which increase their potential risk for developing cancers of the mouth, of the throat, of the voice box. Okay, over the past couple of decades, as smoking has reduced, okay, nationally, which is phenomenal. We found in everything that there is a specific virus that actually causes a specific type of cancer, particularly within the what we call the oropharynx, and that comprises tonsil, the base of tongue, soft palate. That's essentially where the oropharynx, kind of by layman's terms, kind of where that is located. That has been kind of on the steady increase, and so with that, we have a vaccine that specifically targets that virus. And I think this is something where we are kind of approaching now and everything like that, based on guidelines for children as well as young adults. Hey, this is a way of preventing cancer. And it's something that I think that many of us see is this is a way of preventing kind of suffering, long-term suffering, as well as kind of just hopefully getting rid of a cancer type altogether. So I think in terms of a vaccine that has that kind of potential benefit to protect you, from potentially developing a cancer down the road, amongst other things, I think it's a phenomenal opportunity, and something that parents should be discussing with their kids. Parents and kids should be discussing with their primary care physicians or other healthcare provider that they're seeing.
Jon, looking back now, almost 3 years out, how would you describe your quality of life before treatment, during, and now, as you could say, in survivorship?
Yeah, I think that my quality of life has gotten back to where it was before. I mean, I'm very active with my kids, coaching when I can with my kids. I think I'm back to where I was, and I attribute that to the great care I got here at KU.
A lot of people think cancer-free means like everything goes back to normal, but has your survivorship, how does it look like physically, mentally, emotionally? We talked about, kind of mentally it kind of maybe took the biggest toll, but
Sure.
kind of for those who have gone through it or may be going through it right now, what can you share with them?
Yeah, still mentally, I don't know what it is. It's still in the back of your head. Every time you get a sore throat or you might feel something, you go right back to where you were before. So that's mentally where I am right now. It's still in my head that it could be there and it could come back at any time.
Is that true, Dr. Gann? I mean, when he has those sore throats, would that be some sort of signification that he needs to come see you?
Yeah, no, great question. I think in the grand scheme of things, if you're having those sore throats, if you're having kind of that like, hey, lump and bump and everything, obviously it's tough to consider, but all things being common, you're a young guy, you're healthy, you run. There's probably a whole host of, and you have kids, you have a whole host of things that are probably potentially going to cause that sore throat, cause that maybe bump or that feeling that you may have. Maybe some of it is some of the radiation treatment from before, some of that scarring. So I think that it is something that absolutely you want to be mindful of your body. You want to be having that conversation, everything with your primary care or your healthcare providers, your oncology healthcare providers, if this is a symptom that persists over a period of time, not something that goes away or kind of like self-resolves or might have another very, very easily explainable cause, especially if it's during sick season with kids and teenagers and everything. So, but like I said, I think our long-term hope, our goal, make you an old man, just so we can kind of chat together.
Keep him out there running and competing.
Exactly.
Are you still doing that?
I do run a lot. I'm spending more of my time watching my kids compete. My daughter's a swimmer and my son's playing soccer, like I said earlier. So it's fun to watch them compete now.
Yeah, give them
I'll
their
be
turn.
I'll be their cheerleader now.
Good. I like that. Dr. Gann, how can providers better support patients in returning to life, not just surviving, but really living?
Yeah.
Like what Jon is doing. How do we get him back?
Absolutely. So I think something that's extremely important and everything like that. There's a number of things when you are undergoing your cancer treatment. To be mindful of nutrition. I'm not talking about anything extreme, but ASCO itself has published guidelines itself on kind of what are good nutrition metrics. The other thing too is staying active. We're not talking ultra marathoning during your cancer treatment, but potentially staying active by walking, doing light weights, just being active. And I think those things kind of help kind of both your mental state, your metabolism, as well as they kind of keep you going. And then afterwards as well, I think that there is an importance, I think, with continuing good nutrition, exercise, or at least being active. You don't have to, again, be doing extreme sports or even crazy levels of activity, but to stay active is super important, both to keep your muscles strong, but also to keep your mental well-being. And along with that too, recognizing symptoms and speaking with your healthcare providers, your oncology team, to be like, hey, I am experiencing these symptoms. Let's try and address them rather than suffering in silence. Because again, I think quality of life is extremely important, and it is something that we as healthcare providers we want to have this dynamic engagement. And if we can't figure it out, we have support services within physical therapy, lymphedema, again, nutrition, dentistry, oncopsychology, as well as a whole host of other things to try and help get our patients so that they can hopefully get back to living their life the best that they want to live their life.
Let's get to some great questions from our viewers this morning. Jean wants to know, is this a type of skin cancer?
Yeah, no, this is not a skin cancer. So skin cancers, oftentimes, again, squamous cell carcinoma, both for head and neck cancer, the mucosal head and neck cancer, and when I say mucosal, I mean inside the mouth, throat, voice box, is the same as kind of that skin cancer, the squamous cell carcinoma of the skin. And so, but they are very different. And so this one itself, is something that's started in the back of your throat, what we call the oropharynx.
But that's a good question, because you hear squamous cell.
You think
of the
immediately,
skin,
yes.
and you would think
like, oh, well, this is something that's spread to the mouth. It's while they may share similar lymph nodes, especially if it's a skin cancer of the head and neck, it is different.
Sounds the same, but it's different.
Yes.
Okay, Jean also wants to know, what are the long-term side effects of radiation?
Yeah, no, good question. So we think of short-term and late side effects of radiation treatment. And again, it depends on where we're treating. And so specifically for the head and neck, kind of some of the long-term side effects, you can experience kind of that tissue, soft tissue, meaning skin, muscle, kind of where it gets a little bit thicker, what we call fibrosis or scar, okay? Along with that too, you can have changes to your swallowing, okay? Along with that, you can also see changes as well, kind of with the amount of salivation, the moisture that you have in your mouth. Sometimes as well as that, if we have to direct our radiation beam kind of lower down over the voice box, it can actually cause kind of weakening of the muscles in that area where you get a little more tired. I mean, you can still speak, you can still talk, but it might get a little bit more hoarse, a little bit more tired temporarily, especially towards the end of the day. Many of these things we have therapies that can help with kind of reducing those side effects, both medication-wise as well as kind of adaptations, physical therapy.
Jeremy wants to know, is there anything unique about treating cancer in the head and neck versus the rest of the body?
So I think for head and neck specifically, it can be tough. And of course you experienced kind of some of those tough things. And I think part of it is that it's very common for all of us to sit down at a meal and we socialize, we talk, and we eat. And food is something that for many can be quite pleasurable and quite enjoyable. And unfortunately, that's something as part of this cancer treatment, it can specifically sap your taste buds and things start to taste very bland. Your mouth gets very dry and it can be quite miserable. While other cancer types, you just feel like, I just have like, this reduced appetite. I'm just not as hungry. But then after that, you actually can eat still and kind of like, that was tasty. I can still sit with somebody and actually feel it. Unfortunately, I think for a number of my head and neck cancer patients, it's a very tough time. And I think it's something that I think my patients absolutely look forward to we're done. I want my taste to return, and I want to actually get back into the swing of things.
Yeah, because you had that, right?
I did.
Yeah.
I did. It was hard to eat and keep my my weight up. My whole goal was not to get a feeding tube. That really scared me. I did not want to get a feeding tube. So
How long did that side effect last?
Well, it was during treatment. About halfway through treatment, I lost my taste, and so I had to force food down as best as I could.
Because then it was messing with your appetite.
It was, yes. It makes you not want to eat it all because it tastes pretty much like dirt. So everything tastes like dirt.
So you were
it wasn't
force
good.
feeding yourself.
I was force feeding myself, drinking as much protein drink as I could, and then maybe about a month after treatment was complete, I started getting my taste back a little bit. And I still deal with dry mouth, and that's still something I deal with. And I drink a lot of water all day.
So will that go away eventually, or?
Unfortunately, it is unfortunately a new normal because of the fact of kind of where your cancer was. We had to treat one of the specific salivary glands. Okay, we call the submandibular gland, and because of that, it impacted the overall the overall saliva that you have in your mouth. But I think one of the things that I was most happy with your plan was that we were able to really spare the opposite side and protect that one salivary gland as well as a lot more of your mouth. And I think based on that, it's helped with kind of restoring some of that saliva. It's not back at what you or I would have wanted, but I think it's an unfortunate and necessary side effect of trying to try and aim for that curative treatment for you.
Sean wants to know, what are the age guidelines for HPV now, and are there any boosters?
So right now, in terms of age guidelines or anything like that, we're the PCPs are usually trying to get them in. If I'm correct in everything like that, and again, I will defer to the CDC-based guidelines and everything, as well as kind of what the local primary cares are doing. People are usually doing early, within like 11, 12 and everything like that, and they take it out as far as 30. But with that and everything, I know that some are actually providing the vaccine earlier, and so.
What do you want people to take away from this conversation?
Yeah, no, I think again with HPV-mediated oropharynx cancer, this is something that is it's highly treatable, it's highly curable, and this is something that I think it's important to get a multidisciplinary opinion, talking with both surgeon as well as with a head and neck radiation oncologist, to have that discussion about what is the best kind of treatment for you, and then to kind of build that treatment around kind of the patient, and have that discussion about like what are your goals, what are your long-term outcomes, as well as kind of what is potentially the treatment that's going to be the one that's going to not only give you the best outcome, which again both can provide that, but what's going to hopefully lessen the amount of side effects. I think we want to try and minimize the likelihood that you would need both treatments, if at all possible, both surgery and radiation. I think that's our goal, because that's where you're going to see a lot more of those long-term side effects. And if we can find ways to kind of find the best surgical patients, absolutely, get your surgery. Okay? Hopefully you will never need radiation after that. You're cured. Vice versa, if we think that there's a chance that you would need radiation afterwards, again, maybe after surgery, maybe let's have that discussion. Can we just cure you with radiation or chemoradiation by itself, and hopefully not need surgery down the road?
John, what's the big takeaway from your story?
I think that if you notice something wrong with yourself, you notice a lump, you notice anything, go get it checked out. Don't wait for somebody else to tell you to go do it. Just go do it yourself, and go get it checked out and get a professional opinion.
Great
Don't
advice.
start Googling things.
Never. No, Dr. Google. Thank you so much. Just thanks for sharing your story.
Yeah,
we appreciate
thank you.
you. Thank you both for being here. And tomorrow we are meeting another head and neck cancer survivor, so tune in for that. And before we go, we want to let you know about a special guest we recently had here at the health system. Actor Anthony Hill from Kansas City, Kansas visited our cancer center. You might recognize him as Dr. Winston Nagu from the show Grey's Anatomy. He was in town for a fundraiser and wanted to see examples of what cancer researchers do and what the funding can do.
Cancer is one of those things that kind of affects all of us in some way, indirectly or directly. And my dad actually is a survivor. So he was treated at the place we were just at, literally. And he knew a lot of the doctors and nurses there. And it's just, so it's close to home. So there's a personal interest there as well.
Later, he'll help out at the Shave to Save event put on by the American Cancer Society, raising money for Hope Lodge, which gives free rooms and amenities to people staying in town for cancer treatment. Thanks again to our guests today, and thanks to our viewers for being with us. We'll see you back here tomorrow. Coming up tomorrow on the Morning Medical Update, life on the Virgin Islands can feel like paradise, but when Patrick Sena learned he had cancer, he knew he needed specialists on the mainland. I'm Jessica Lovell on the next Morning Medical Update. The radical surgery that took parts of his throat, tongue, and palate, but let him get back to island life. Hear why his diagnosis let him skip chemo and radiation. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stei's podcast. Now, everywhere podcasts are available.